Hello, hi everyone. Hope you're fine. Today, we are going to be talking about a preventable cancer, but saddeningly, it is still killing many of the women in this country, Uganda, and that cancer is cancer of the cervix. Amongst all other types of cancer, it is cancer of the cervix that tops the list in those cancers that causes deaths amongst women in Uganda. Um, and that has interested us so much to speak about cancer of the cervix. Now, what is cancer of the cervix? So these are two words. There is cancer and there is cervix. Meaning, this cancer of the cervix attacks the cervix. The cervix is the lower part of the uterus that is found in women. Um, the cervix is made up of small cells, and the uneven growth or the abnormal growth of those cells is what we call cancer. Um, Someone may ask, what causes cancer of the cervix? Unlike some other types, cancer of the cervix is caused by HPV, the human papilloma virus. And someone may ask, where do we get the human papilloma virus? Or, yeah, where do we get the human papilloma virus? How does it enter the female genitalia to go and cause changes on the cervix? HPV, or the human papilloma virus, is mainly spread through sexual intercourse and safe sex. This is how it can get from one woman to another. From one woman to another. So we are seeing HPV as the main cause of cancer of the cervix. Um, what are the predisposing factors, if you may ask? Predisposing factors means these are factors that put you at risk of getting the HPV and thus cancer of the cervix. So predisposing factors are the same as the risk factors. One, since HPV is mainly spread through sexual intercourse, that means having multiple sexual partners puts you at risk. Multiple sexual partners is our first predisposing factors. And in this, what do I mean? Um, a man, I may have four women, and amongst the four women, and possibly each of them may have a sexual network. So, if I come and get into sexual contact with one, then another, then another. So, if I'm transmitting, or if I'm acting as the carrier of the HPV, then it means I'll pick it from one woman to another, and that is how the HPV virus is spread. So having multiple sexual partners puts you at risk. Number two, having the HIV infection. We all know HIV puts our immunity or affects our immunity or lowers our immunity. And in that, the HPV thrives in immunities that have been compromised already. So it will be easy for it to go at the cervical cells and cause cancer of the cervix. So having HIV infection um, puts you at risk. Another thing is starting sex early or having early sexual debut. We find that people who begin sex so early come into contact with many partners. And in that case, those many partners, it puts you at a higher risk of getting this HPV virus. Number 4, like any other cancers, smoking. We are seeing smoking affecting the immunity of the body. And in this case, once the HPV finds when your body is already weakened, um, you will see it thriving there. etc, etc, and many other more. But let me mention this. Not everyone who gets the HPV infection will get the cancer of the cervix. It all depends on your body immunity. Um, if the immunity of your body is strong, or when the HPV infection or when the HPV virus gets the immunity of your body when it is strong, definitely the body will wear it off. But when this HPV finds when the immunity of your body is low, definitely it will bring changes on the cervix. So there are various changes that we get at the cervix, and these are, there is what we call precancerous lesions. A lesion is simply a wound on the cervix. Abamu mutera okugenda ne babakebera kansa w'omugga n'abaana, and you will hear your health provider telling you oyina amabwa ku cervix oba oyina amabwa ku mumwa gwa nnabaana. That means they may be precancerous lesions or cancerous lesions. Cancerous in brackets, cancer of the cervix. Now, here is what to look out for. Oh, these are the warning signs that are supposed to really make you worry. 1, pelvic pain. We understand pelvic pain cuts across other gynecologic infections, but in this case, pelvic, you should pay close attention to pelvic pain. Number 2, unusual bleeding. Unusual bleeding. Unusual pervaginal bleeding, meaning bleeding from the vaginal orifice or from the vaginal opening. Please, unusual in the sense that, okay, you may be in the years that are still menstruating, but when your cycle is disturbed or when your cycle is not regular, you should worry. Number 2, there is bleeding that occurs in postmenopausal women, oba omukyala eyakoma okulwala n'addamu okulwala ng'amazeeko ekiseera nga talwala, be tuyita postmenopausal women. That is also something to worry about. Then there is foul pervaginal discharge. Foul smelling pervaginal discharge. Ti ovaamu amazzi agawunya, obunduka amazzi agawunya okumala ekiseera nga kiwanvu. Amazzi agawunya gategeeza ebintu bingi, naye tomanya. Please embrace going to the hospital. You have a checkup. Cancer w'omumwa gwa nnabaana or cancer of the cervix, when spotted early, it can be treated and you can be declared free from cancer of the cervix. Someone will ask, how do we detect cancer of the cervix? Tutegeera tutya nti musawo ntandise okulwala cancer w'omumwa gwa nnabaana, cancer of the cervix? There are various screening types that help you identify your HPV status. And one of the commonest is VIS screening, the visualization under acetic acid. The health worker will get an already mixed acetic acid, as we will describe it in the coming videos of how they screen cancer of the cervix, but for now, we shall mention the screening methods. We have visualization under acetic acid, uh, we have pap smears, etc. etc. Those are the commonest that we are having in our locality or in our settings, commonly the settings that we have in Uganda. Then we also have the HPV DNA testing, where your health worker will give you a brush and get a cervical swab that will be tested for different strains of HPV. You know, HPV virus is a big family, and there are many more strains for HPV. But in this particular case, the HPV DNA testing concentrates on those strains that have higher chances of causing the cancer of the cervix. How do we prevent cancer of the cervix? Okay, so here when we speak about prevention, um, there are many ways in which you can prevent yourself from getting the HPV virus. One, there is a vaccination. Vaccination. Um, the vaccine is already rolled out. It was rolled out in 2015, and it is available in all government settings and some private settings. Um, we begin vaccinating from 9 years up to about 14 years. Um, it is so important that you take your young girls, our daughters, to the facilities to receive the vaccine. It's just one jab like this that will save the entire life of that girl. Uh, us knowing that cancer of the cervix is on top of the list of those cancers that cause cancer related deaths, cancer of the cervix tops the list. So please, vaccination is so important. Number two, the other way in which you can prevent yourself is by knowing your HPV status. I mean, screening. Screening. Like we mentioned earlier on, there are many modalities for screening for HPV virus. HPV virus here can be detected by HPV DNA testing as a screening modality. There is VIA, where we use acetic acid during screening, and pap smears as well. So, and these are cost-effective methods that each of every woman can really get in almost every facility. Please, let's be mindful of our bodies. Let's know our HPV status today. Please move to the health centers, hospitals, and take an HPV screen. Know your status. Know your HPV status. Um, for VIA and other modalities, we begin from 25 years to 49 years, or even earlier than that. That is if the woman or the girl in this case had an early sexual debut. There are those who begin sex early. So there, the screening adjusts a bit and starts earlier on than 25 years. Yeah. Now, the other thing is treatment. Treatment, where everyone now wants to listen. How can you be treated when they have known you that you have, or when they have discovered that you have cancer of the cervix? But before we go to treatment, how do you discover that you have cancer of the cervix? Like other cancers, the test that confirms that you have cancer of the cervix is a biopsy, biopsy, biopsy. And like in our previous videos, we've been trying to understand why a biopsy is. A biopsy can only be taken when a person who has screened you or when a health worker really sees that you have the signs and symptoms of cancer of the cervix, the warning signs that we've spoken about, um, let's say when you come to the health facility and you have unusual vaginal bleeding or unusual bleeding from the vaginal orifice, you have pelvic pain, you have foul smelling, vaginal discharge, and that has stayed there for long. The other step that I'll go to is inserting a spatula in the vagina to be able to see or to be able to visualize the cervix. And now, when I find that what I've seen at the cervix is highly suspicious of cancer of the cervix, that is when I will do a biopsy. Biopsy kitegeeza omusawo ajjako akanyama ne bagenda ne bakeekebejja ne bakakebera. So they pick off a tissue sample, it's very small, like a needle of the pen, very small. Then it will be tested in the pathology lab to be able to look at how cells are growing, how cells are dividing, and if the division is unusual. If the division is quite faster from the normal one, then really cancer of the cervix will be confirmed. Now, the other question that we normally receive from our patients is, I have received a cancer cervix diagnosis. What do I do next? And here we will be able to discuss the treatment options for cancer of the cervix. One, there's chemotherapy. Here they are treating using drugs called chemo. I'm sure most of you have heard of chemo. Then we have radiation therapy or radiotherapy. Abamu kyemuyita okukalirira. Here they use special rays to kill the cancer cells, and they may also do surgery depending on how your treatment is proceeding. Now, here is a final call to every woman, to our sisters, to our daughters. If you've reached the age of being screened, that is 25 years to 49 years, or if your sexual debut was early, or if you began sex so early, please walk into a health facility, get screened. Cancer of the cervix is real. Early detection saves lives. You never know. You may be able to restrain yourself from cancer of the cervix. Cancer of the cervix is so bad. It gives so bad effects, and we really don't want any of you to go into that. Thank you so much.